the pain series. Today we're going to discuss shoulders pain, hips pain, and knee pain. Who is this video for? So this webinar is for anybody experiencing pain in the shoulders, hip, and knee area. Doesn't matter what your age is. If you've had a hip replacement surgery, knee replacement surgery, or if you had any shoulder surgeries, this is for you. If you are dealing with an ongoing pain that comes and goes, this is for you. And again, it really does not matter what age you are because we deal with pain at all times in our lives. And this video is for the purposes of clarifying the reasons for the pain. Hi, my name is Magdalena Bednarek, and I'm an online health coach. I am a traditional Chinese medicine practitioner. I have masters in acupuncture and herbal medicine. I am also a recall healing certified health coach. And I enjoy health because I have it now. I didn't 11 years ago. I always share my story. I was diagnosed with about 9 autoimmune diseases, and I'm in full remission today. So it's been an amazing 10 years in the making that got me to where I am right now. And I've learned a lot about diseases. That was my intention. And I believe that was my life's mission. I believe I came here to get sick, get better, and spread the word how I did it. And on my journey, I have discovered that there are 3 aspects of every single disease, every single symptom, every single condition, no matter what it is. There's the physical aspect, emotional aspect, and energetical aspect. Usually, we address only one. We go to our doctor, Western medicine, and that's a physical aspect. The physical aspect is your body, the symptoms that can be seen. That there's a rash, we see that. There's an injury, we see that. That's a very physical, right? Your diet is very physical. Your environment is very physical. So in the physical aspect, a lot of Western medicine and functional medicine characteristics come in. The emotional and energetical aspects are very tricky because they're like Wi-Fi. They're there, but you can't see them. But they are there. And I'm going to discuss the emotional aspect, which is German New Medicine, which is recall healing, which is very, very important. And most of us don't understand that pain is emotional. Think about it. Pain is emotional, and we'll discuss it later. Energetical aspect is traditional Chinese medicine. Everything about energy and how it flows through the body and how we have either excess or deficiency. We're going to discuss it all. It's fascinating. You're probably going to learn something you've never heard before. I don't want you to take it too seriously. I want you to learn from this video just somebody else's perspective. Just think about it, entertain the thoughts that, hey, she got to where she is by understanding this. Maybe I'll learn something new. Again, this is not medical advice. I need to talk about a medical disclaimer. This is not for the purposes of treatment or diagnosis. This video is for purposes of education only. I am sharing with you my experience. I'm sharing with you what I've learned. I'm sharing with you what I preached and what I've learned in medical grad school. So let's begin our wonderful journey into the shoulder, hip, and knee pain. And they are connected. That's why there's one video about all of them. So first, we're going to go through a Western medicine definition. I always do that. I always present to you multiple approaches, the 3 approaches that I've discovered. So this is from International Association for the Study of Pain. Pain is an unpleasant sensory and emotional experience associated with a resembling that association with actual or potential tissue damage. Actual or potential. That means inflammation. And even in the Western medicine definition, they talk about emotional because the reaction you're having, you're literally reading your emotions within your body. So chronic pain is invisible and thus subjective. right? We can't see it. We cannot tell. If you have a rash, if you have redness, if you have swelling, if you have bumps, that is visible, that is objective. But subjective is just, oh, it hurts and that's it. We have to take your word for it, right? Pain is whatever a patient or client says it is. And pain is personal. And believe it or not, when there's not a lot of things going on in your life, when your life is very generic, ordinary, and there's many people who have no hobbies, no passions, the pain becomes your hobby. The pain becomes your point of interest. You start to identify with the pain. Before you had nothing to talk about to people, and now you have the shoulder pain. Now there is the knee pain. There's a lot of reels on Instagram that say, oh, I'm single, but do you know what hurts? My left knee hurts. Now you identify with the pain, and that's not a way to healing. That's actually reinforcing the emotion behind your reaction. Yes, it hurts, but if I'm going to make my life about it, it's going to hurt more. Do you see how that works? And we're going to go over it later on. But don't let your pain be your identity. This is why I stopped saying I am sick and I started saying I'm healing. I'm healing. Yeah, I had the pain, but I'm healing. It's in the past. It's not here anymore because I'm healing. My body is constantly healing. If you haven't read an amazing book by Florence Scovel Shinn, The Word is Your Magic Wand, I highly, highly recommend it. Everything you say creates a vibration, and it does come true. So if you say something negative, the negativity will show up in your life. If you say things that are positive, more positive things will be attracted to you because it's the same vibration. And here we are talking about manifestation instead of chronic pain. So the function of pain often serves as an adaptive, protective role in the organism. Pain is a signal. I want you to understand that in traditional Chinese medicine, we always say the body is a map. The body is a constant communication with you. It will always send you signal, that little headache, that little pain, that little pinch, indigestion, nausea, any type of symptom. Your body is telling you, oh, listen, there's something wrong. And the reason for this, the signaling may be different for every single one of us. For me, all the reasons were physical, emotional, and energetical. For you, it could be just your diet. For you, it could be just lack of movement. It doesn't have to be all three, but I'm giving you reasons for all three of them because I've noticed that whenever there's something that's recurring, keeps on coming back, that means that the root cause is still there. I healed. I am in full remission because I addressed what was causing the issue. I had multiple symptoms that were labeled as autoimmunity. But when I started looking at all those symptoms separately and understanding, oh, there's the reason for that, that's the reason for that, and eliminated the reason. And there's multiple things that were causing it. I had an infected root canal. I was living in mold. I was in a toxic relationship. I was emotionally unstable. I was smoking cigarettes. I was drinking on occasion with MTHFR gene mutation, which is like a disaster in the making. And I had terrible diet. So a lot of things in my life contributed to all of the symptoms. My body was overflowing with toxins and I didn't know how to address it. And no doctor could help me. And believe me, I had 2 rheumatologists, which both of them I fired. And then I saw multiple specialists, and none of them told me to support my detox organs. And that's what I learned through herbal medicine. And we're going to talk about the magic of herbal protocols that did wonders on my healing path. And I'm still doing them because I believe in Mother Nature. Mother Nature, for some reason, works on me. When I was taking prescription medicine, I suffered every single side effect. Like literally, if you could read the side effect lists, that was me. So they were making me worse. So I had no choice. It's like literally the universe kind of pushed me like, I'll give you all those side effects. So you'll look into the herbs. And I did. And it turned out great. I have more energy today at 44 than I did in my 20s. Yeah. It's crazy. It's crazy how supporting your detox organs works. It's just amazing to me. Let's continue. What causes chronic tissue damage? Because that's the reason for pain, right? Potential tissue damage or severe tissue damage. So it's accumulation of toxins and pathogens. And this includes everything, guys. Heavy metals, root canals, mold, anything can be in there, allergens, whatever is sprayed in the sky. If your detox pathways are impaired, because let's say you have chronic stress, then this is what's going to cause damage to your tissues. Parasites are another one, and parasites are not the root cause. They only show up if you have either low immunity, which is chronic stress, or heavy metals. Living in mold, because mold, again, mycotoxins can mimic any disease and can cause you pain anywhere in the body. Once they get into the bloodstream, it's their pick. It's their pick. Some people have pain in their wrists. That happened to me. I was diagnosed with rheumatoid arthritis at 33 and I couldn't move my wrists. Living in chronic stress, we all know that what stress will do to you. It's a slow progressive body changes, because high cortisol will affect every function in your body, and one day you just wake up and you have pain, and that pain, believe it or not, it took about 20 to 30 years for it to develop. Your body tried to protect you, but because it had no support, it had to show you a signal. Listen, there's pain. And this is how sophisticated and amazing our body is. Wrong diet. Most of us don't pay attention what's on our plate. And of course, lack of movement, stagnation. And I will talk about this many times throughout this video, because I want you to realize how important movement is, especially for us women. When we turn 30, our muscle mass starts to decline every year if we do not exercise our muscles. Our muscles are there for us to use them. Our body literally has been made to move. I don't know who invented the couch. I love the couch, but it's not good for us in excess. Yes, it's good in moderation, because we do need to prioritize rest, but do we move enough? And most of us, like I do, we have a sitting job. I sit in front of a computer. I sit in front of the pain. That's how I do consultations with my clients. And guess what? Unless I prioritize movement, so I try to do my steps and I weight lift 3 times a week. That's what works for me. We're all different, because I have histamine intolerance. My muscles get a tendency to be overworked. So I really have to take it slow, and I really have to be progressive with my weightlifting. But I love it. It's something that I do. It doesn't have to necessarily work for you, but there's options. There's so many options we have right now that you need to let go of your excuses. Now, this is very important. I want you to understand that lack of painkillers in your body did not cause your pain. Yes, we do tend to run to painkillers because we need to function, right? But I want you to understand it's just a Band-Aid. The root cause is still there. This will not lower your inflammation permanently, because this is not the reason for your pain. Okay, so that's the only thing. And there are side effects to painkillers if you take them for too long without addressing a root cause, which, remember, Western medicine was not designed to look for the causes, most definitely not emotional or energetical causes. But this is what you have to understand. I'm not telling you to stop taking your painkillers. I want you to function, but I also want you to understand that yes, there are other causes that could have actually be the root cause for all of your symptoms. And like I said, they're physical, emotional, and energetical. So the causes. We have mobility issues. None of us ever works on their mobility. Even me, I just started a couple months ago. Yeah, it's amazing. Lack of muscles, of course. I have to tell you a story about back pain, and I do share it in my webinar on low back pain. Lack of movement and micronutrient deficiency. So as a acupuncturist, during my during my clinical internship, I saw most of my patients with lower back pain. And all of those patients had no muscles on their back whatsoever. They never exercised them. They they expected a return on an investment never made. Imagine that. And when we talked to them about exercising, they were like, no, 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 no. So those people were literally treating acupuncture as their magical pill. You know, the pills from their doctor stopped working, so they're looking for another pill without changing their lifestyle. We're going to talk about lifestyle a lot. Your lifestyle is the totality of who you are right now. It's how you move, it's how you think, it's how you dress, it's how you eat, it's how you function. This is your lifestyle. Now think about it. Your lifestyle got you to where you are right now. So if you want to be somewhere else, if you want to be in the pain-free world, you have to change your lifestyle. There's no other way. This is how it's done. I've changed everything from what I was thinking to who I was hanging around with, because we become who we hang around with. There's a constant exchange of energy. So unless we work on our muscles, and my friends, I need to tell you this, you're never too old to start working on your muscles. Age is just an excuse. I don't care how old you are. It's just an excuse. Get to it now. And I'll tell you how to start. Because if you never worked on your muscles, it may be harder for you. So metabolism is our superpower. I educate on this a lot because I want you to have an understanding of what your body does for you at all times. At all times. The body, you know, there's the body, mind, and soul, right? So the body has been designed to keep you alive at all times. And this happens through metabolism, our superpower. We all have metabolism. This is how our body is designed. The first part is catabolism. Catabolism is a destruction of a cell. Every second of every hour, every minute, a cell is destroyed. And anabolism comes in, which is a creation of a new cell, replacing that old cell. So we regenerate constantly, right? So what happens? Why do we get wrinkles? Why do we get shriveled up? Why do we get old? Why do we lose our hair? Because we provide the body the wrong environment and the wrong building blocks. Yeah. So the body cannot constantly regenerate. But if you ever notice how the body works, if you get a cut, you cut your skin, it heals by itself, right? You may put some cream on it, but it heals. It does the same on the inside. Exactly same procedure is on the inside. So if your shoulders hurt for too long, something's wrong. Why isn't the brain sending a signal to the shoulder to heal? It may not have the correct building blocks. There may be an emotional disturbance. And the most important reason is you may not have enough energy. And that is something that I've noticed with most of my patients in traditional Chinese medicine. And it's all about the energetical aspect. But I want you to understand metabolism. You can Google this, you can research it. We all have our metabolism. We all do. And our metabolism is so wonderful if you start providing the right building blocks. I have less gray hair than I did 10 years ago, and I have less wrinkles than I did 10 years ago. Because it's not the creams that I use, it's not the shampoo that I use. It's because my body has enough building blocks from the inside to rebuild itself, enough vitamins. If you have vitamin and mineral imbalance, it's impossible for your body to function properly. How do we test that? Well, this is not something the insurance covers. Of course, why wouldn't? You do micronutrient testing. Most labs do it. Your doctor will do it if you ask him, but he'll let you know that micronutrient testing is not covered by insurance. And also HTMA, hair mineral tissue analysis. This is the most accurate way to measure your minerals through the tissue. Your hair or your nail, that's your tissue. And it needs a balance of minerals, because minerals, when we test them in the blood, it could be irregular, because remember, your blood flows all the time, and it just depends. There could be more minerals somewhere else in the flow, not exactly where we are taking the blood. Think about it. Your circulation, it's always moving. I know you don't feel it, but your blood and so many fluids within your body always move. And the body works for you so that you're here. You're watching it, and you can love the body and you can thank the body, because the body's literally saving you. And we are not appreciative enough. But when the body gives us pain, oh, we scold it. Oh, we hate it. We say, oh, I feel so horrible. I hate this body. You're not thinking about the fact that this body is doing everything it can to keep you alive right now. And instead of supporting it, you're literally scolding it. So let's appreciate our bodies. Okay, you can work with the outside. That is what you can control. If you've never worked out in your life, I highly, and you have pain, especially if you have pain, physical therapist. They will show you what exercises to do, how to build the muscle that is required for your body to work optimally. Don't do it alone. Don't do it with YouTube videos. Guys, that's a recipe for disaster, okay? If you don't have pain, then I say get a personal trainer. That's what I did. A couple of years ago, I worked with personal trainer for 8 months. I've learned everything, and now I know a proper posture. I know a proper weight. I can do it by myself. I've learned it. Use a chiropractor. Use an osteopath. There's so many wonderful doctors out there that can actually help us with our posture. Utilize this. Is it an investment? Of course. I wouldn't be here if I didn't make investments in myself, sharing this story with you. But guess what? Every one of those investments I made paid off. And I invested my time, I invested my energy, and I invested my money. And they all paid off. And then also work with the inside, because remember, where does your pain starts? It starts on the inside. So meditation, working with your breath, crucial. And on my website, there is a free meditation. My website is umlacademy.com. Download it, do it. It's a wonderful way to bring awareness to your breath. Diet modifications, and we'll talk about it later, and herbal protocols. Those are the main key, because herbal protocols, they address all three aspects: the physical, the emotional, and energetical, because the herbs made by Mother Nature enter your meridians and help to balance your energy. And they oftentimes help to fix the root cause. They did for me, because with the right support of my detox organs, now my body works optimally and I feel fantastic. Okay, we got to emotional aspect. So I think that's all for now for the physical aspect. Now, I am not your therapist. This is not a diagnosis. Do not take it personally. This may or may not resonate with you. If it does, then you're welcome, because I just gave you an explanation why your body's reacting with pain. So your emotional state is manifested as your physical body. Everything you think about yourself manifests as your body. So guess what? Pain doesn't come out of goodness. No, it doesn't. And where everything else fails, but pain is still there, this is when we look, okay, maybe there's something deeper here. Maybe this is why you're losing energy. And that's more of the energetical aspect. So emotional aspect, I will explain this from recall healing. And shoulders, hips, and knees have different explanations, versus an energetical aspect, it's a little different, but we'll get there. So again, this may not be you. This may not, but I want you to understand that how much our emotions affect our physicality. There's so many books about this now. This is the biology of a cell, guys. You will turn into that which you think you are. So shoulder pain and recall healing. First, we're going to talk about dominant shoulder. Okay, you have two shoulders. One is dominant, which is the hand you write with, and one is non-dominant. So whichever it is for you, whether you're right-handed or left-handed. I am right-handed, so this is my dominant shoulder. It's a conflict with personality as an individual unit. We saw a lot of men after a divorce with a shoulder pain. Why? Because suddenly they're individual. They're no longer identifying as a family unit. And guess what? They don't know who they are. Because usually their wife was the organizer, the planner, the provider. And now they ask, who am I as a person? And that brings shoulder pain. Also, you don't see yourself as others see you. You think you could do better or you could be better. You feel like you are stuck, you need help. And for some reason, could be from childhood, you don't think you deserve love or you are not worthy. And that will also weaken your shoulder. Sometimes just realizing those things help the brain understand that the conflict phase is over and allow the healing phase to begin. Because in recall healing, we have an active phase and a healing phase. So in an active phase, that's when the emotional disruption is. We usually have no pain there. Usually the pain starts in a healing process. But because we didn't realize that, okay, maybe it's me. Maybe I have low self-worth. Maybe I feel stuck, but I'm not doing anything about it. So then the brain cannot send the signals because you're still stuck in that situation. I was stuck for many years in a toxic relationship, and my whole body was in pain. At the very healing stage where it started, when I started realizing that, hey, I can do better myself, the body started the process of healing. So think about it if this is something that resonates with you. Let's talk about non-dominant shoulder. So this is the other shoulder of the hand that you do not write with. And this is a little bit different. It also represents loss of self-worth as a family member or with specific family members. Let's say you had an argument with your aunt, with your grandma, with someone, and it's not resolved. What kind of mother, father am I if I am raising my kids like that? This happens very often if your kids are talking back, they are in a conflict with you, and you're wondering, well, what kind of mother am I? Well, unless you change the mothering, there's no resolution. The brain needs to know that there's a resolution in order for it to send signals to heal. What kind of a son or daughter I am for my parents? What kind of a brother, sister I am for my siblings? What kind of a granddaughter, grandson I am for my grandparents? So this is what Gilbert Renaud talks about in Recalled Healing. He's a wonderful doctor who noticed and discovered those patterns. And this could be very specific for some of us. If you are in conflict with any member of your family and you experience shoulder pain in your non-dominant shoulder, think about it. Think about how to find a resolution to that conflict. And then the brain will work with you, and we'll talk about what holding a grudge does to you when we get to energetical aspect. Now, there's more. Shoulder pain and the non-dominant shoulder. It is also loss of self-worth in a relationship with a mother-child dynamic. Supporting questions. Who are you waiting for? Who are you carrying on your shoulders? Who you no longer want to carry? And there's a lot of women I met who were in a marriage where they felt like they're carrying their husbands on their shoulders, and they're carrying their entire family lives on their shoulders. And the shoulder got either dislocated, either rotator cuff got torn, surgery was needed. They were carrying someone who wasn't their responsibility on their shoulders. We are here to help and nurture each other, but we are not here to save each other. Every adult is responsible for themselves. Yes, we may ask for help, of course, but none of us wants to be a burden. And let's get to hip pain and recall healing. So that is sexual in nature, and it can have many aspects. So it's a conflict of lowering worth, of resistance or rebelling. An example is, I don't agree with the sexual position my partner prefers. And a lot of us don't know how to communicate our needs. A lot of us don't even know our needs. And that's where the conflict starts. Remember, recall healing is explained as a brain conflict with the reality. If we knew how to communicate properly within our relationships, so many issues would have been solved. It's a conflict of rebelling against your mother. You were acting as if your mother was good, but your behavior was different because it was a survival tactic. Because as a child, perhaps you knew that this is it. That's how your mother is, and you have to just agree with her because you have no other choice. And it's a need to agree with something you don't agree with. And this is why we see a lot of hip injuries in elderly. So broken hip usually happens during the healing phase, and most common in elderly when they don't agree with living accommodations but know they have no choice. And most of those people never exercised. They are not mobile. They need help. Their muscles are deteriorating. This is exactly what happened to my grandmother, who never exercised. Yes, we got her a physical therapist, but she refused to exercise because she was so busy watching her TV. She became a burden to the whole family. She couldn't walk herself. Versus my grandfather, uh, he was this was my maternal grandmother, and my paternal grandfather, who passed away at 96, perfectly mobile, working out every day, taking long walks, never taking always taking the stairs, never taking the elevator, eating right. He lived up to 96 fully mobile. He would have lived longer, but he was born with a heart defect. This is all about the lifestyle choices we make. And again, it's never too late. No matter how old are you right now, you can change your life. So maybe the emotional aspect does not apply to you, but perhaps it was your diet and your lifestyle, your lack of exercise will do that to you. Okay, and knees. How many of you had the knee replacement surgery? I've had a lot of patients with knee replacement surgery, and it's very hard to treat because once there's a foreign tissue in the body, there's a lack of energetical flow, basically, in that area. So it's a conflict of obligation and obedience. I have to work for my mother even if I don't want to. Obedience without resistance. Were you ever obligated to do something? To bend the knee, even if you didn't want to. And this happened to those of us who had overbearing mothers. It's also a low self esteem because of sports. It could be a spiritual conflict because in many religions, they make you bend the knee. Even if you do not understand the philosophy behind the religion, you are still obligated to do it out of respect, but you may not necessarily agree with it. And religion, for many of us, is pushed on us by our parents. We don't have a choice. Jesus picked his religion at 33, and we make our little children who know nothing what they want to do. We make them do what we do. We don't know if that's right for them. I allowed my children to have a choice, whatever they want to do. I first encourage them to do detailed research and make a choice for themselves when they are old enough. Conflict of standing, walking because of weak knees. And okay, so that's the end of the emotional. Emotional aspect, again, we look at it when all else fails. But for some of us, we may have the perfect diet, perfect lifestyle. We may exercise 4 times a week, and we're still in pain. What's going on? Well, then maybe one of those emotions, maybe one of those emotional states, maybe it's a conflict with your parents, especially with your mother. Maybe, it's you were maybe you're obligated to bend the knee. Maybe you have overbearing wife. Maybe your husband has a preference of a sexual position you don't agree with, but you don't know how to communicate it because you don't want to be rejected. Could be so many reasons. This is just an example for you to take it further on your own. So, energetical, this is my favorite aspect. Look at the gallbladder meridian. Do you see that line going all the way from the head through this point? There's a point right here on the shoulder. It goes through the shoulder, it goes through the hip, it goes through the knee, gallbladder meridian. That's why I wanted to have all of those pains in one video. Emotion, resentment. How many of you are holding a grudge? How many of you have your gallbladder removed? Yes. This will show up energetically within your body. And if you understand that everything is energy, everything, energy responds to energy. If your energetic signature is resentment, woo, that pain will keep on coming back. So, energetic aspect in traditional Chinese medicine. Have you ever had gallstones? Have you ever had pain at the right side? Maybe not enough bile, impaired fat digestion. Maybe your gallbladder was removed. This is a very popular treatment. I do have a video on how I saved my gallbladder from being removed, and I've had gallstones and I've had attacks on multiple occasions. I still have my gallbladder and I plan on keeping it, but I let go of my grudges. I've had many. No gallbladder, no protection. Please keep in mind that your gallbladder has no such a function as to create anything. It does not create the gallstones. Those are created in the liver and dumped to the gallbladder. It is the liver, yes, which is anger. So bile protects you from parasites. If you do not have a gallbladder, there's like no chance of not getting infected. You have to be very, very careful. Thank goodness there are bile supplements nowadays. Bile protects from other pathogens. Bile neutralizes and alkalizes your intestinal walls, and it promotes peristalsis, which means without proper amount of bile, you cannot go number 2. This is a main reason of constipation. People don't know it. And before you had your gallbladder removed, did your doctor go over the list of the side effects in detail with you? Yeah, they didn't, because that's not what they do. Gallbladder meridian. So it's excess resentment reduces energy in gallbladder meridian, making your shoulders, hips, and knees weak. Herbal protocols restore energy as herb enter the meridians. So, and now I have this story for you because I've had a patient who had a knee surgery. I believe she broke a tendon or something happened. She was coming for acupuncture, and I asked her, how did this happen? She said she had an injury during volleyball. But I told her, but you're so athletic. How come? You know, you look like you have a very well-balanced muscle mass. You look like a healthy, happy person. What happened? And she said, well, it's a very common volleyball injury. And I asked her, does everybody who play volleyball has it? And she said, no. And I told her, exactly, because your gallbladder meridian was weak. Not everybody's gallbladder meridian is weak. We are also bio-individual. We all have different emotions. If you do not hold any grudges, the energy will flow fine. If you hold grudges, if you resent, a lot of us resent our parents, we resent the government, we resent the schooling system, we resent the weather on a daily basis. We do this to ourselves. Nobody taught us how to let go, how to be the observer, how to enjoy the experience of everyday life. We're here to learn and experience. Okay, so some people understand the emotional aspect of resentment, but there's some of us who just don't want to allow this thought to settle in, like it's something illegal, like, oh no, that could not possibly cause the weakness in my knee. Yeah, it did. It did. You may not believe it. I always say this, you may not believe there's gravity. It doesn't matter. It's still there. Your emotions are still there, and your energetic signature is still there, and your physicality is based on that. So if some of us get only the shoulder pain, some of us get only the hip pain, some of us get only the knee pain, I had another patient, wonderful patient, who was 52 and was getting ready for hip replacement therapy because she fractured her hip and it never healed. And it was her diet. She was a vegetarian, not by choice, but because she didn't have enough enzymes in her stomach to process her meat. And so she became a vegetarian without realizing her body was like missing amino acids and minerals to rebuild itself. So for her, she was really healthy. She liked to walk. She was pretty active, but her lifestyle of her diet was actually making her worse. And I respect every single one of you, no matter what your lifestyle is, but I do want you to get micronutrient testing and hair tissue mineral analysis. It will tell you everything. And that's where we go from. There's some people who are healthy on vegetarian diet, and there's some who are not and don't know about it. We're so different. I tried it. It didn't work for me. I was on it for a year. And when I did micronutrient testing, I was in shock. Almost all of my vitamins were out. And I paid a lot for that blood test because, again, it was an investment. And I was determined to get better. Okay. Herbal protocol. There we go. Okay. So this is how my journey started. This is how I started healing from autoimmunity. I did a foundational protocol twice. It's a 4 steps, 4 months protocol. So I did it for a total of 8 months. And guys, like I said, pain could be caused by accumulation of toxins in your body. If we do not support our detox organs, there's nothing a doctor can do for you. And I do have a webinar on detox. If you're interested, look on my channel. This protocol is designed to support detox pathways. It's a foundation of cleansing, and it's the best investment I ever made. Yes, it's an investment. You want a return? Invest. You have to invest in your health, just like in everything else. It's a wonderful protocol designed to introduce. The first step is always the Jumpstart Kit, which prepares the body for any further cleansing. It addresses parasites because most of us have them, but please keep in mind, only 30% of parasites are visible. Most of them you will never see. But it does not mean you don't have them. Dr. Hulda Clark wrote a wonderful book, The Cure for All Diseases, and she talks about it a lot there. And yes, I've had severe parasitic infestation because my detox organs were not working. I was born with MTHFR gene mutation, so I always struggled, and I was filled to the brim with toxins, heavy metals, whatever else was there that was making me fatigued every single day. It was like, I swear to God, it was living a different life. I was so sick back then, I ended up on my deathbed and I was dying until I made a decision to get better, and universe guided me. And so first I was a client of Cellcore. I had my own practitioner, and I decided to go to medical grad school to become their practitioner because I want to spread the word of how I got better. Another option for you is, again, if you don't want to do it for 4 months, you can do Jumpstart Kit. Then we do liver support bundle, which is 1 month. And then you may do it more if you need more support. Or depending on your symptoms, we can do detox support bundle. But the liver support bundle addresses the liver, the kidney, and the gallbladder. So that's the best for you. And then they also have a wonderful supplement, which is included in the Jumpstart Kit and liver support bundle, which is Advanced TOTCA. Anybody without a gallbladder should be on Advanced TOTCA. And then there's also other companies that do ox bile, which you can look into. Because if you're struggling to release bile and you have a very fatty meal, you need additional support. So how to order? Sign up at cellcore.com. This is my practitioner code. Take a screenshot or find me on Instagram if you don't already follow me, Universal Mama Lena Academy, where I share daily with you the tips that help me to be where I am right now. I do a free herbal consultation. I answer all your questions about any herbal consultations before you place an order. You can also visit umlacademy.com. This is my website where I share my story. I have many ebooks, masterclasses, articles, and a free meditation that I mentioned before. So this is how you order through me. Only my clients get a free consultation, and all my clients receive a free masterclass, Parasites, over 2 hours of lecture, everything you need to know about parasitic infestations, because parasites are something very, very overlooked in Western medicine, and yet they have a tendency to cause all kind of pain. Parasites can live in any tissue, any organ, anywhere on your body, and you may not even know it or even detect them. And I would like to tell you about this wonderful, wonderful quote. The only conclusion worth drawing is that if you want to be healthy and beautiful, you have to change your lifestyle. Remember, I told you we're going to talk about the lifestyle. Lifestyle is a crucial aspect of our health. When you see someone who is sick, you know their lifestyle needs work. Why pain? Why do we have pain? So I want to talk to you about this because pain is a sign of inflammation. Inflammation is a communication from your body that there is something in it that doesn't belong. Your body communicates to you. What could it be? It could be anything from allergens, pollution. Think about it. If you live in a big city, there's pollution everywhere, everywhere. Whatever they're spraying in the sky, preservatives in our food, the taste enhancers in our food, the seed oils that they use, parasites, toxins. There's mycotoxins. Whenever you are exposed to mold, and it can be anywhere, you may be taking the same bus every day that has mold and you may not know about it. And this all happens when your detox pathways are affected. The most common reason for our detox organs to stop working is chronic stress. Who here lives without any stress? Hand up. We all have stress. Stress is actually very needed for our body. We need something challenging because this is how we grow and evolve. But when it overtakes and you get those obsessive thoughts and you keep on thinking, oh, I'm a failure, nothing ever works for me. Oh, this is so hard. This is an uphill battle. Oh, I hate this pain. Whenever you have a thought like that, your cortisol goes up. When your cortisol goes up, your body autonomic system moves to fight or flight. It thinks it's going to have to protect itself. When it's in fight or flight, it cannot heal. We can only heal when the body is relaxed, rest and digest. You cannot digest when you're about to be fighting. But that's how we give ourselves the stress, okay? And this is most of us. I had a lot of patients who would watch the news religiously every single day, get the same amount of stress, and then come to the clinic and ask me how to reduce the stress. And I told them, stop watching the news. You're giving it to yourself. You're getting an emotional reaction about something you cannot control. The only control you have is you right here, right now. Your decisions, you control what you do. You control what you think. You control with what you think. You can control how you feel. And your body, your emotional, your feeling is a manifestation in your physical body. But if I tell you to reduce the stress by reading a book instead of watching the news, and you tell me you can't do it, then I can't help you. Same thing goes for people who watch horror movies, who engage in gossip, who engage in judgment. If you judge, you guys, everything comes back to us sooner or later, and the body is the first to feel it, okay? And you can have excess emotions, or you can have deficiency of energy. Either or will cause each other. I used to be very emotional. I would take everything super seriously. And I really thought that it's me against the world and everybody's out to get me. Everybody's wrong. I'm right. And that got me to autoimmune diseases. Yes, I was very critical. I was very judgmental. I didn't know how to be any other way because that's what was modeled to me when I was a child. We are the way we are because we learned it. Everything you do, every daily ritual, whether you exercise or not, all the decisions you make, somebody showed you how to do it. As a child, as children, we had no choice. We had to learn what was shown to us, right? We wanted to belong, we wanted to be accepted, and most importantly, we all wanted to be loved. But guess what? As adults, we have a choice. You can see whether your lifestyle works for you and you have no pain and you're flexible and you're happy and you just enjoy your life. Guys, I got to a point in my life where literally my mind plays classical music for me. It's so pleasant. But it took me years to get to this point, to enjoy myself, just being here, just existing. And when you enjoy yourself, there is no pain because the energy is in balance. But when your thoughts continue to go to the negative avenue, well, you're walking that path. So how can you expect positivity when you're literally surrounding yourself and creating with your thoughts the negative life? There's ways to change that. We can all change, we can all choose. And it's the little habits. It's the little habits. So first, what are you feeding your mind? That's important. I'm not telling you that you have to become a nerd like me and start reading books. No, there's plenty of documentaries, there's plenty of beautiful motivational movies. Yesterday, I watched Kung Fu Panda because it's such an amazing motivational story for me that I watch it on a regular basis just to remind myself that there is no secret ingredient and I am the secret ingredient because I believe in myself. There's just so many wonderful things in this life. And think about it. You have access to technology at your fingertips. You can use it to research remedies instead of symptoms. You can research anything you want. This is the power of technology we have right now. You can learn how to change your ways. It's what Dr. Joe Dispenza always says. Your change starts when you change the little daily habits. And if you would like to know how hard that is, I have a challenge for you. Move your utensils from the drawer you keep them into a different drawer. And I want you to notice how long it takes you to go to that new drawer, because you're going to be doing it unconsciously. You're going to be coming back to the same utensil drawer that you had for years and years and years. But is it possible? Yes, I do it on a regular basis. I change the drawers on purpose because I don't want to be used to the one pattern. I want my brain to work, not just one side, both sides. Another exercise that is wonderful to help you reprogram your habits is start brushing your teeth with the opposite hand. That's going to be a challenge, but it's fun. It's literally fun. I really enjoy that. I do it on now it's easier because I've been doing it for quite a long time. But guys, this is all your lifestyle. And I can encourage you to change your lifestyle. Like I said, your lifestyle got you to where you are right now. And even if you're a buffed guy, you exercise, and yet you torn your shoulder, well, guess what? It may not be your diet. It may not be what you're doing. It may not be your habits. How is your relationship with your mother? Are you carrying anyone on your shoulders? Some mothers are like that. They cannot let go of their children and they become a burden that the child has to carry on their shoulders. Have you ever heard the saying that we carry the weight of the world on our shoulders? That's literally it. And it's not ours to carry. We're supposed to carry only ourselves. And that's perfectly proportional to who we are. It's not supposed to be too much for us. It becomes too much for us when we carry other people's problems. Okay? So this is what I wanted to talk to you about. Pain will always be a communicator. It communicates that either there's a physical issue wrong with your body, there's an emotional issue that is unaddressed, or that there's not enough energy for it to recover itself, and thus metabolism is affected. I bet whenever you go to a doctor, they never talk to you about metabolism. And I'm so happy that I can explain it to you because I loved learning about it in medical grad school. It made so much sense that, it's not that I don't heal. It's just that my body doesn't, I don't support my body's environment and I don't support my body's building blocks in order for it to heal. Guys, I suffered with severe adult acne. My body was never healing. And it was also overflowing with toxins because the skin was dumping out whatever the liver and the kidneys couldn't. Imagine that. How sophisticated our body is. Our body is always working for us. Take good care of our bodies. And thank you. Find me on Instagram, guys. Universal Mama Lena Academy. Go to my website, umlacademy.com. Ask questions. Be interested in your health. Healing is beautiful. I would very much appreciate feedback. If you could tell me if you learned anything new, if you liked what you learned, if you understand this perspective, if there's anything that you did not understand, I would love to clarify. But I cannot tell you to go exercise. I cannot make you. Just like I cannot heal for you. No doctor or practitioner or provider is supposed to do the healing for you. You do the healing. We are all, as adults, responsible for our own body, our own health. I can share with you my story and tell you what worked for me. I had severe knee pain back in my 20s when I was about 25, and I was learning Kung Fu. And so we had the horse dance and my knees were killing me. And I was undergoing physical therapy for that because I wouldn't let go of the sport that I loved. And back then I was just obligated to do things for my mother. And I didn't know how to say no to her. I've learned with time and I've learned how to communicate it with love. I set up very firm, loving boundaries. But I resented her because I couldn't tell her no. And that was that was the reason for it. Now I understand it, why I had such I could barely walk. And I was very, very fit. Imagine just being, 25 and exercising because I would train a lot, my tip-top form, and yet my knees were killing me. Yep. So that's my reason. And then we all have our own story. Every face tells a different story. Whether it applies to you or not, I hope this video gave you something to think about and maybe gave you another option. Yes, you may invest in an herbal protocol, but that herbal protocol, unless you fix the junk food you eat and you start exercising, it will not have such a tremendous effect as it did on me. I addressed it all, guys. I did the whole lifetime changes in order to get to where I am. I understood that I have to move. I understood I have to be interested in what I eat, in what goes on my plate, and how I deal with my emotions, how I handle stress. I addressed it all. And herbs just did wonders because I was on the right path. But this was also a starting point for me. And it can be also a starting point for you. This is why I recommend it. This is why I became a cell course practitioner, because I believe in the power of Mother Earth. We are organic, natural being, and so is Mother Earth. And Mother Earth provided us those wonderful herbs that we can use today. So thank you so much for being here. And until the next time,